With concerns over fentanyl use rising, the city of Denver now is providing a life-saving tool for free.
As Denver 7's Rob Harris explains, this program has seen a sharp increase in demand, making supply an issue.
We did not have that supply on hand because we had never pushed out that much before.
It was a good problem in a sense. According to the Denver Department of Public Health and Environment, so many people wanted to carry naloxone that their systems were completely overwhelmed.
There was a whole lot of media attention about it. So we ended up getting 4,500 orders in less than 2 months at this point.
Around 4,500 orders in February and March, compared to just 500 in the 5 months prior. The combination of that surge in demand and distribution issues from suppliers led to months of backlog and requests going unfulfilled. Now, DDPHE says they found a new supplier and have received a shipment of about 3,000 kits. They're honoring requests in the order they came in, and they hope to keep getting regular shipments to keep up with the demand.
So folks will start receiving their things. We're really excited about that. We are so thrilled that everyone wants to carry Narcan and learn how to check their drugs and make sure that people in their communities are safe.
Increased attention caused the spike in requests for naloxone in February, but the need has been growing over the past decade. According to the Colorado Department of Public Health, 1,477 people died from drug overdose in Colorado in 2020, up from 1,072 in 2019 and up from 653 in 2010. That's a 126% increase over the course of the decade. Those numbers represent real lives lost, but advocates say the numbers would be even higher if it weren't for this life-saving substance of naloxone. We asked a mental health advocate here in Denver to share her real-life story of witnessing an overdose and reversing it, potentially saving a life. Samantha Rabins is a program manager for Mental Health Center of Denver.
I am holding 2 doses of naloxone, otherwise referred to as Narcan, and I carry it with me in case I were to be around or witness someone overdosing so I can help save a life.
Rabins was in a meeting with one of the center's partners when a person rushed in off the street, saying a man was outside experiencing an overdose.
We walked outside. I had all my work stuff, of course, and we walked outside, and the person was very evidently overdosing on the ground, and we were able to deploy Narcan. I also was able to call for backup with police and fire and medics in order to get them transported to get the care that they needed post naloxone. And they were revived. It's a really out-of-body experience to watch someone in the process of dying, and it's not something I ever signed up for as a social worker. My job is to prevent people from getting to that point, and so my thought is, what can I do to save this person? It's so amazing to be able to have a tool to be able to revive someone and give someone a second shot, a different shot, to continue to live their life the best that they can.
Now, if you're a resident of the city or the county of Denver and you would like to carry naloxone for free, we got a link to the city's request form at thedenverchannel.com. People outside of the city limits can also get naloxone by visiting stoptheclockcolorado.org. And